My name is Roy. I work as a CT Technologist. A typical day for me here is during our patients, I will go out to our waiting room and greet our patients. There's always paperwork there that we pick up, but before I get there, we look at our computer and everything is computerized. We see our patient's name, procedure ordered, and what to expect. We have their name, their age, and the diagnosis that we're looking for. So I will proceed to the waiting room. I know exactly who I'm looking for. I walk into the waiting room, we call them by name. We go over and greet them, and then we escort them back into our room here. Once we're in the room, we have a questionnaire that we ask that physicians need, our radiologist needs the information so they can compare that with the images that we send to them. So, and also this helps us to put the patient at ease. So once we've got that done, we explain to the patient what we're going to do, exactly how I'm going to do it. I lay them on the table and again explain to them certain procedures we do requires intravenous injection of contrast material. So we'll tell them what we're going to do. We start the IV, we put the contrast in, we tell them how it's going to make them feel. Sometimes it makes them feel warm. It gives them kind of a bitter taste. We explain all that because we want them to be completely at ease. Some of our patients are a little claustrophobic. We will lay them on the table and show them exactly what it's going to be, and it really relaxes them. And we are very age specific, whether they're a child or an adult or elderly person. You have to be very specific on how they're going to be treated and what it is, and it really helps them. And once you know, and we walk them through it step by step. We're going to do this first, this second, and once I'm there and the patient's comfortable on the table, I leave the room and go to our console and do the CT scan. And once the CT scan is completed, I check all of my images to make sure that I have all the information that's going to be needed for the physician. There's certain steps I must take with the computer once the images are completed. And with this, I have to manipulate a lot of our images. We make 3Ds with our images. We make, and we're doing arteriograms. We can make just the vessels. We can show just the bones. We can show just the tissues from the contrast that we have added, which enables the physician to see all of this that they need, and they can make the proper diagnosis from looking at our images because they know what's normal. Anything that's abnormal, they're able to see from what I send them and how I manipulate the images through the computer so they can help them. We work like from 7:30 in the morning till 5 in the afternoon. There's two of us that work in this facility here, and we work, we alternate our shifts. So one's at 7:30 to 3, and the other one is 9 to 5, which is very good. Our stress level that we have here is primarily we want to make sure that we can do the best we can for the patient and to get the diagnostic images that the physician needs so they can best treat our patients, whether it be for our cancer patients, our urology patients, or one of our other patients that we're doing for their angiography. So it's, although we have certain levels of stress, the reward far outweighs those. So we're very fulfilled in doing our procedures here in our job. The requirements for doing this position, first and foremost, you must complete high school. And if you have a lot of background in anatomy, physiology, and math is very helpful. Then you must have an associate's degree in radiology. And once you complete your radiology and that course, it's heavy in math, heavy in science, very heavy in anatomy and physiology, which you would normally think you must have. And then once you complete your associate's degree in radiology, then you would petition and sit for your national boards. And the national boards is given once a month at different sites around the country. And everybody takes the test. It's the very same test every day. I mean, of every state. And everybody takes it. They are very security minded, so there's no cheating on the exams. And it's all computer based. And the good part is, as soon as you finish your exam, you know you're pass, fail, and your grade. The bad part is, pushing that button when you get through, do I want to really complete or I want to go back? And once you do that, then you are certified in radiology technology. And then to continue on for a CT technologist, which I am, you can either go back to school and you'd have to re-enter and you would take courses in just CT technology. Or most CT technologists currently, and myself, I did my training kind of on the job training, and where we learned from a certified CT technologist and under a physician supervision. We have to document that we have done hundreds of different examinations, and we must present proof of that, have our radiologist, chief radiologist, submit paperwork that states, yes, in fact, we did do these examinations and we were proficient at that. We send those to our registry board. Once the board gets that, they will send us back certification that we are eligible to sit for our boards. And once we do that, we sit for our boards and we have a national license. And then our national license are also recognized by all of the states. And each state will accept the national registry. It's the American Registry of Radiology Technologists. They're our governing board. And then from there, we can go back to school even more and we can get our BS degree in management. We can get one in business, business management, healthcare. And I know this sounds like a lot of education. However, the more education we get, you look at the bottom line, we are able to market ourselves much better, and the higher our salary will be, and the more desirable we will be. And there is internet sites through our ARRT and ASRT, which is the American Society of Radiology Technologists, that post all jobs in the country, and even some overseas, and they post the salaries and the minimum requirements. And most of the minimum requirements is associate's degree, but a lot of them now are asking for BS degrees because they know that you are serious about your profession, my profession, which I'm very proud of, and which enables me to keep my skill level up. And each year we must get our continuing education. Myself, I go to several seminars which teaches the newer techniques, what's coming along new, what I need to be more proficient in, what I need to learn, and I'm able to bring that back and share with my patients, with my physicians, and it makes myself a much better technologist and able to do what I feel like I need to do to bring the care that my patients need every day. The best part of my job is that I like the most. It's hard to say what I like the most because it's such a rewarding career. I like coming to work every day. I thoroughly enjoy going up and seeing my patients. I get to call them my name. They know my name. Here where I work, we have a lot of patients that come back over and over. We know each other. They know who I am. I know what they need. And it helps put them at ease, and they're just so good. And also I feel like it's rewarding. I'm able to use my skills, my education, to help get their diagnosis to make them better. They enable their doctor to treat them and give them the care that they need. So we're kind of like the first step. You go to your doctor, he checks you, he orders different tests. They come to my department, the CT department. I'm able to do the procedure and really pinpoint what may be wrong with the patient, and that is so rewarding. I like that the most, just being able to have direct patient contact. The other part that's on the downside, that's the least favorite of my job, is sometimes it's self-imposed. Sometimes I feel like I have not done the best that I can, and that puts a lot of pressure on me that I have maybe missed something. So that is hard. So I have to stay on top of what I'm doing, but if I don't, I go home in the evening sometimes and feel like I have not done the best that I possibly could, and that's the hardest part. The other worst part about my job was sometimes working in different hospitals. The equipment may not have been as good, the environment may not have been as good, but on the other hand, this place is the first place I've worked that was not a direct hospital, and is in essence the best place I've ever worked. I know it may be difficult sometimes to decide, do I really want to go into the medical field or CT or radiology? But there is all of the hospitals in the country, they have a volunteer program. Through the high school, you can check with your guidance counselor, and you can go to them and they can get you into the hospitals, and you can specifically work in a department that you want to. You can go and you can spend 1 or 2 days a week or on a weekend, and you can work directly with the technologist. You work in a department, you can see what they do every day, day to day. You can see everything that's good, or you can see what maybe they don't like that we don't always talk about. But that would be a great opportunity. Do as many anatomy classes as you can get, math classes that you can get. And especially computers, because now everything is computer, and all of our new generations are computer. It's a very rewarding career, and as you can see, I'm more than 18 years old, and I have raised my family doing this profession, and it's been very good to me. So, and I highly recommend it. There is a need for CT technologists. You will never be looking for a job. The environment that you work in is excellent.